Congressman Tom Perriello met with students at Danville Community College today. The big issue is affordable education and health care reform. Ashley Singh is live in Danville. And you know, Ashley, Congressman Perriello certainly touting this plan, but he is saying at least that young people are very excited about reform.
Yeah, and he says one reason is because they don't have to think about health insurance. That's because they can stay on their family's insurance plan for longer and focus on learning.
We've made a huge step, the biggest in a generation, to make college more affordable through the student loan reforms.
It's reform that affects young people. Congressman Tom Perriello says the health care law makes it easier for students to get an education and to have health insurance while they do it. That's because they can stay on their family's health insurance plan until their 26th birthday.
So often those years where you might be in and out of a community college or another training program, maybe your first job is part-time, you're going to be able to have that health insurance on the family plan.
He says this allows them to focus on things like education and training. 21-year-old Jasmine Farmer agrees. She's glad to have a few more years under her parents' health insurance because it's one less thing to worry about right out of college.
Not many 20-year-olds really think about health care. I can go home and tell my mom now, I'm on your health care plan, so I'm 26.
They don't have to say, well, I'd really like to get that degree so that I have a better salary, but I'd give up my health care if I left this job.
Perriello says it's important for young people to be part of the health insurance system.
We have a problem in areas like Southside Virginia where such a high percentage of our population is uninsured that those that have private insurance have been having to pay more and more to keep the system going, and that's not very fair.
Students say insurance isn't always on their priority list, but that maybe it should be.
Most young people are not worried about health concern, but things come up.
Critics say it's not fair to force young people into getting health care, especially if they can't afford it. But Perriello says having young people on board will take the premium pressure off of middle-aged and older people in the community. Live in Danville, Ashley Singh, ABC 13.